Hey guys, so today we're going to talk about congestive heart failure. Um, Congestive heart failure, it affects a lot of people, and a lot of people don't think about that. But it affects a lot of people, and it's very dangerous. So I made this poster here, and it's just got, it's got a heart, and then this is a normal heart. Um, it's not as it's thin. Um, and then on this heart, the heart is too big. It gets too thick, and it makes it hard to pump blood. And it makes it really hard for the other organs in the body to function. So um, congestive heart failure, it is a chronic condition where the heart muscle is weakened and it cannot pump the blood correctly in the body. So the risk factors is coronary heart disease, diabetes type 2, smoking. If you smoke, that'll affect you a lot. Being obese and overweight, that puts a lot of pressure on your heart. That makes it not want to can't pump as well as what you should be at your regular weight. Um, your age, hypertension, congenital heart disease or defects, and then of course the valve disorders. Um, the diagnostics of congestive heart failure, you can do it by a chest X-ray. You can tell if you have congestive heart failure by chest X-ray. Um, echocardiogram. It looks at the heart's function and the strength of the heart, and whether you can tell whether it's working correctly or it's not, if it's strong enough or if it's not strong at all. You know, the treatment, you can do diuretics, fluid restrictions, exercise. Exercise helps a lot with the heart. It keeps it going. Salt restriction, daily weight, weigh in daily. Um, a pacemaker or defibrillator that can also help with congestive heart failure. Um, and I also, kind of I know several things about congestive heart failure also too because I am a patient care tech at my local hospital. And so I have to calculate the fluid intake and output. You know, if they have too much or if they don't have enough, or how much over fluid intake they have. So the signs and symptoms of congestive heart failure is shortness of breath, chest pain, edema, weight gain, dry hacking coughs. Um, so that's going to be signs and symptoms. There's a few more, but I didn't list everything on my board. And also the right versus left failure. The right, the heart is unable to pump enough blood to the lungs. So in other words, you can't breathe right. You can't breathe like you're supposed to. So then you get a setback and you can't breathe properly. You struggle to breathe and catch your breath. The left of the heart is unable to pump enough blood. Sorry, it's not blood. It's unable to pump enough oxygen out of the body due to the weakness. So if your body's weak, it can't pump the oxygen out that needs to go out. So that's the difference between the right and the left um, sides of the heart and the failure. So to end with this is how you protect yourself from heart failure. Stay active, exercise, run, go to the gym. Don't sit at home and eat little Debbie cakes. Follow a healthy diet. Watch what you eat. Not saying you can't have a snack or Christmas tree cake, for instance. That's what's going around now. But regulate your diet. treat heart related conditions. If you think you have a little bit of a heart problem, well, go to the doctor before it gets too bad and you go into heart failure. Avoid drugs and alcohol. Drugs and alcohol has a huge effect on the heart because it makes your heart go over rhythm, and when it does that, that damages the heart. Um, Manage your stress, manage your weight, and manage your sleep. Don't sleep too much. Don't sleep too less. Like I said before, don't get obese. Don't get too skinny. And your stress. If you have stress and anxiety, hey, go to the doctor and get you something for that. So thank you so much. Oh, and also I was going to say this. You also gather fluid around your lungs. Um, it can also make your stomach bloated, and then it will make your legs and feet swollen from the edema for having too much fluid in your body. So thank you so much, and have a great day.